Hey everyone, welcome back to Clinical Physio with me, Khalid Maidan. In today's video, we're going to be taking you through some top tips for asking special questions during your patient's subjective examination. So for particular body parts, you need to ask specific questions in relation to patient safety and management. Let's go through them. So for patients who present with cervical spine or shoulder symptoms, the things that you need to look for are the 5 Ds and the 3 Ns. The 5 Ds are dizziness, diplopia, which is double vision, dysphagia, which is problems swallowing, dysarthria, which is problems associated with the motor component of speech, and drop attacks. The 3 Ns are numbness, nausea, and nystagmus, which is rapid oscillation of the eyes. And here you wouldn't ask your patient, do you have nystagmus? You would ask, do you have any problems with your eyes or your vision? And these are all questions to rule out the potential presence of sinister pathology of the cervical spine or the brain, such as a stroke or VBI, which stands for vertebro-basilar insufficiency. So next, for your patients who present with lumbar spine or hip symptoms, you'll need to ask about the following. First is difficulty with micturition, i.e. passing urine, and it is retention of urine in particular that we need to look for. Next is the loss of anal sphincter tone and or fecal incontinence. Next, saddle anesthesia, which would be loss of sensation, pins and needles or numbness around the anus, the perineum or the genitals. Next, sexual dysfunction, and this would be erectile dysfunction for men, and it would be vaginal or saddle pain during intercourse for women. You also need to ask about widespread weakness, which you identify covers more than one nerve root, or progressive motor weakness in the legs, or gait disturbance. And these are all questions to rule out the potential presence of sinister pathology in the lumbar spine, such as cauda equina syndrome, or a lumbar spine tumour. And now on to questions that you need to ask for your patients with hip and knee pain. These would include locking, clicking, and giving way. And these are all questions to rule out the potential presence of structural pathology at the knee or the hip, such as a meniscal tear for the knee and a labral tear for the hip, and also ligament ruptures too. So, next, here are some examples of subjective signs that you will particularly want to pay attention to if they surface at any point during your subjective assessment, as they raise the index of suspicion in identifying sinister pathology. Now, this is not an exhaustive list, and we would urge all clinicians to have a comprehensive understanding of red flag pathology. So some examples are the first onset of spinal pain under the age of 20 or over the age of 55. Constant, unremitting, non-mechanical pain. Unexplained or questionable thoracic pain. A personal or family history of cancer. Feeling systemically unwell. Unexplained weight loss. And or widespread neurological symptoms. So now that you've asked all of these questions, you will have gained a wide range of information about your patient's condition. This should allow you to consider whether or not your patient is suitable for physiotherapy, or where they need to be considered for more urgent or alternative medical treatment. For example, this means establishing whether your patient has simple mechanical back pain, or whether they have potential signs of a sinister spinal tumour, which would need obviously a very different approach. And that completes our video on special questions. And we would like to suggest you look at our other videos within the clinical assessment catalogue based around the subjective assessment. Thank you as always for watching, and we'll see you again soon right here on Clinical Physio.